Hello everyone, welcome back to my channel. This is Dr. Zina speaking, the face behind Dr. Dentistry. Today I will be speaking about if you have white patches in your mouth, you shall never ignore them because they might be life-threatening. Let's start with the first reason. Number one is an oral thrush. Oral thrush is a fungal infection that can cause, as you can see, a creamy white patch that covers all over your tongue. Often, it is associated with slight soreness that you can feel or redness underneath. The oral thrush is commonly seen among the diabetic patients with high level of sugars, or can be seen among patients who continuously use their dentures and they do not clean them at night, or overnight wearing of dentures can lead to oral thrush as well. Number two, it could be irritation or trauma like cheek biting, sharp teeth, braces, or poorly fitting dentures. They can create wide, thickened areas. I could say that this is the most common one that we can encounter nowadays. The medical term is the minor uphless ulcer or minor ulcer, or an ulcer as simple as that measures around less than 1.5 centimeter that often goes away by itself, so no treatment is required. Or you can say the treatment, it depends on the cause. If the cause is sharp teeth, you need to go to the dentist and they do smoothing for your teeth. If the cause is poorly fitting denture, as simple as that, you need to go to your prosthodontist in order to replace the denture or do relining or rebasing. Number three, which is the second most common, I can say, after the minor upper ulcer or irritation or trauma, that is smoking. Whether you are smoking vapeless or vape, it can also lead to a white patch, and this white patch, the medical term, we define it as leukoplakia, that you need to dig deep into leukoplakia in order to look for it, because it's risky and it's life-threatening. Next, it could be burns or inflammation, like eating hot food and drink, coffee, tea, etc. It can irritate the mouth and temporarily cause white or peeling areas, like you can define it as a first degree burn, which often goes away by itself, so no treatment is required. Just we need to ask you in order to relieve your pain is you can eat honey or cold things like an ice cream because it acts as a vasoconstriction which will help to reduce the pain for you, and drink plenty of cold things rather than hot things should be avoided for 2 weeks period or until the condition subsides down. Next, it could be lichen planus. What is lichen planus? Lichen planus is an inflammatory condition that can affect the lining of the mouth. It may appear as a white lace-like whipping that is seen on the buccal mucosa. Buccal mucosa means the cheeks. Some people may also experience burning sensation, soreness, sensitivity, especially with spicy or acidic food. Now, the exact etiology behind the lichen planus is not yet known. There is many possible etiology that we can say. One of these, it could be a viral infection, like an EPV virus, which is the Epstein-Barr virus, or human papilloma virus, that is HPV 16 or 18. The most common is the 16. Or it could be genetic, from parent to son or daughter. So there's many possible etiology behind the lichen planus. Now you might ask me, how do I know if I have lichen planus since there is different etiology behind it? I will share with you the most common signs that I saw in my patients. So there is a list of red flags that I did. I wrote them down in order to see if you have any one of these. You need to seek a dentist in order to confirm your diagnosis. So let's look at them. Number one is a patch that doesn't heal within 2 weeks period. Persistent pain, burning, or tenderness. Ulceration or bleeding. A patch that becomes thicker, harder, or changes appearance. Red and white patch rather than white alone is more riskier than having only white. Why? You will know later on. A lump or swelling in the mouth or neck that is persistent also. Difficulty swallowing, the medical term dysphagia. Doctors. Speaking or opening the mouth, medical term trismus. Unexplained numbness, a sore that keeps returning in the same spot. So these signs, if you have any one of these, you need to seek your dentist as soon as possible in order to know what is the etiology behind your lichen planus. Now here I just shared with you an example of a patient of mine that had a lichen planus and it was confirmed by biopsy. As you can see, there is several areas of ulceration that is persistent, and the patient came after 2 weeks of persistent ulceration because you know that once you have, for example, if you have a minor atlas ulcer, you cannot sleep at night because of the pain. What if the patient is having an ulcer that is persistent for more than 2 weeks period? He cannot eat, he cannot sleep at night because of the persistent or continuous pain. Now, what about leukoplakia? I said that this condition is life-threatening. So also I gathered up red flags that if you have any one of these, you shall never ignore them. You need to seek your dentist immediately. And these are a white patch, see, same as the lichen planus, that doesn't go away for 2 weeks, longer, etc. Less than 2 weeks, normal. More than 2 weeks, that's abnormal. Red and white appearance, that is mixed red white equal to erythroleukoplakia. This is the most dangerous one. Erythro means red, leuko means white, so it's a mix of red and white patch. Irregular, thick or nodular surface. Ulceration, the ulcer is also associated with bleeding. You know, the ulcer shall never bleed. If it bleeds, that's where it's dangerous right now. It became abnormal. A patch that is growing or changing over time. Pain or persistent soreness. Location on the side or under surface of the tongue that is considered to be the high risk sites. The high risk sites are in your tongue, the lower tongue, in here, down, not up, the lower part, the floor of the mouth also. This is the high risk sites. Why? Because if you have an ulcer in these sites, it can travel back down and can cause dysphagia, that is the medical term for difficulty swallowing, right? Lastly is no obvious cause, especially in someone who's non-smoker. You have leukoplakia and you're a non-smoker. You need to know the reason behind this, right? Now, this is a simple example of a patient of mine that had a leukoplakia. He's a heavy smoker patient, late 50s, around 56 years of old. He had leukoplakia that was discovered routinely during a dental examination. He just came for simple filling. But then I noticed these white patches. I asked him several questions and then I confirmed the diagnosis by taking a biopsy, which is the leukoplakia. Final takeaway message: not every white patch is harmless. If a leukoplakia patch is persistent, thick, irregular, red and white, or starts to ulcerate or bleed, it's a red flag definitely. Don't ignore it. Get it assessed by a dentist or oral health specialist.